but they don't know what it took to get to said level.
Mm-hmm. Mm-hmm.
And it's my way of trying to reassure them, the roller coaster that I went through to get here, you'll be fine. You'll be fine, right?
Hey, hello viewers. Welcome to another beautiful episode of the Nana Yaya Bua podcast. I have a
Hey.
very special guest on this podcast with me. You know, a beautiful soul that you don't realize that you touch a person and years later you cross paths again with them and they tell you what you did or what you didn't do. And Lucy,
Yes,
oh girl, I am
sister.
so proud of you.
Oh, wow. God bless you. God bless you.
I'm so proud of you.
God
Welcome
bless
to
you.
the Nanaya Yabua podcast.
Yes.
So in today's episode, both of us have our RNs, so we intend to have conversations of the difficulties, in the job, and also the hidden pressures in nursing education and trauma informed learning, which is mostly your background, and being the founder of Nurse Decoded, being an adjunct professor, you hold most of the answers or all of the answers to the questions I'm going to ask.
I got some ideas.
You got some
Just
ideas.
some
Okay.
ideas. Yeah.
So let's see. Let's get it on.
All
Welcome to
right.
today's episode. I'm thrilled to have you.
Thank you. Thank you so much for having me. I really appreciate it.
Ah.
Thank you.
So let's start with the world of nursing education. Since you're still there, you're still in
Oof.
school.
Yes. Wow.
What
Yeah.
is it like behind the scenes and some of the challenges that most of us don't notice? I only know professors I didn't like, professors that I thought didn't know Jack from Jill, and how they became professors. And I know that I have received students as a preceptor, and I had to re-educate them on life, and they're telling me we were never taught this. And I said, yes, you will never be taught this until you meet me. Then I will teach you some stuff
Like
about
when I met
life.
you.
Like when you met me, and look at where you are. I am so proud.
Oh,
I
wow.
did something right.
Yes, you did. You did. This is why we're back on each other's path again.
That is right. That is right. That is right.
Yes. So,
So,
mm-hmm.
mhm.
Go ahead. Go ahead.
I was just about to sew you into the conversation.
Yes, 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 yes. No, one thing I want to say from a student perspective, I'm not one of those people, and I always tell my students this too. Although I think I'm fairly clever, I have some level of intelligence, but school was definitely not a walk in the park. It was so hard for whatever reasons. It could be external factors. It can be, like you said, professors that are not empathetic in any regard. There's no room for humanity for some reason.
Mhm.
And it would hurt, like I'm just saying that to say, because sometimes, you're teaching students and they think, well, professor, you're already on this level, but, they don't know what it took to get to said level.
Mhm. Mhm.
And it's my way of trying to reassure them, the roller coaster that I went through to get here, you'll be fine. You'll be fine, right? So all that to say, nursing education, and this is not unique to Canada. This is global. I don't know
Mhm.
why. I guess it's rooted in historical context. Nursing education is very military like,
Yeah.
right? And even so that we function in a military style, right? We
Mhm.
function with military time. We
Mhm.
use terminology like the nursing station,
Yes.
right?
Yes.
Reporting, right?
Yes.
So
Yes.
that's what it is. And particularly when you're educated, at least my time and before, by more senior nurses who have been in in the game for a very long time. They are academics. They do research. They're PhD holders. I don't know what happens, but they don't got a whole lot of time for whatever you're capable of doing and not capable of doing. Either you got the passing grade or you didn't move. That
Yes.
was it, right? Um, so that's from my lens as a student, and life. There's life. We have kids, jobs, illness, just struggles, right? And I don't think that should dictate whether a person can and cannot be successful in a particular course or whatever the case may be, despite their passion, right? They got
Yes.
a passion. So after I joined the other, and I never actually ever wanted to be an educator because of this. I said,
Mm.
no, I'm not teaching. And my mom actually used to say, oh, you will be a teacher. One of those declarations, like, you are going to do it. I said, I'm not doing it. That's too much work. Why would I do that? Let me take care of my patients and go. I liked that. I engage well with my patients, their family.
Mm-hmm.
I feel good. But then I found myself thinking, like guiding, like similar to what you did for me.
Yeah.
I see them there. I see the struggle in their eyes, right? I see it's hard. So be the nice one that can extend that branch. Come,
Mhm.
relax. Let me show you how it goes. Let me give you my wisdom.
Yes.
That's how it happened.
I think, and that's very wonderful. What many times the academic doesn't get it is breaking it down to bite-sized pieces, humanizing it,
Yes.
because if I learn, about empathy, for instance,
Hmm.
how do I embody empathy?
Well, let's go back to what is empathy. Empathy is not that you understand what somebody is going through, but that you can try to imagine and put yourself in their shoes and be
Yes.
considerate of that lens.
Yes.
That's empathy. And then I tie it hand in hand with compassion, right?
So I just break everything that you guys do in the classroom. Empathy is based in value systems. So you got to be able to tell me what your values are, and that's your moral compass. And when you're able to come to that and break it down and tell me, then we go to the patient and
Yeah.
we practice it. Because until you know what your moral compass is as a human being, not
Hmm.
as a nurse, but as a human being, then you become a good human being. A good human being becomes a great nurse. So
Thousand
I,
percent.
I, I have to do a lot of unpacking
You're a
for,
psychologist, like you getting deep into the psyche before they even allowed to practice, which is amazing.
but that's where I get the quality out of them. And when they start, it's like when they come intimate and then within a week or two, they're blooming
Yep.
because they've understand the core necessities of being human.
Yep.
The simplicity and the part that will make you go crazy. How do you deal with it
Yep.
if you do not know yourself? So we do a lot of self, I do
And
a lot
so,
of self learning with it.
and
Yeah.
everything that you're mentioning there, although, in
Maybe you
our,
got away.
yeah, well, although, listen, what I was going to say is like, although in our education, we're
Mhm.
forced to learn about self reflective practice and self awareness, someone's
Mhm.
telling you to do it, right?
Yes.
But what you're doing is what's called transformative learning, where you're intentionally making the learner self reflect and um, have emotions tied to whatever the lesson is.
Oh,
And when an
yeah.
emotion is tied to the lesson, you don't forget it
Oh,
and it just
yeah.
continues on. This is what's missing from the classroom, right? Because they're giving us theory and science and know this system, know this skill, man, you better do it in 10 minutes and you have one shot to do it and get your 75%. If you don't get it, you repeat the whole class and pay the whole $3,000 all over again. And that rigidity doesn't align with humanity, empathy, compassion. Now, I'm
Mhm.
not saying you just pass people who don't know what they're doing,
Mhm.
but you have to look at all sides, right? Every field we know, there's the people that are really book smart, and they'll fly through school. When you see them in the field, you're like, how?
And those people scare me.
Yeah. And you know exactly who they are right out the gate. And then there's the others who maybe had a tougher time. I'll put myself in that boat. Maybe they
Mm-hmm.
didn't pass their exam, their license exam right away, had to try again in a different way. Didn't get a full time job right away, got to bounce with agencies, had to, whatever the case may be. But I don't think I'm stupid. I just
Yeah.
think I have a different life trajectory based on whatever it is we were going, it was going on in my life. And it's the most wonderful learning experiences I have ever had
Mm-hmm.
is when a prof said, you know what, it's okay,
Mm-hmm.
get yourself together
Mm-hmm.
and then come back to me. That's it.
Mm-hmm.
Because the norm is for you to get shut down. That's it.
Yes.
You didn't do your assignment on time, well, too bad, nobody feels sorry for you, that's a zero.
Mm-hmm.
Right? And I've had profs tell me that, like how you said, the worst profs and whatever. And I
Yes.
remember them by first name, last name. I remember exactly where we were sitting. And they would say things like, I don't have pity for you. Or I can't help you. Or it is what it is.
it, as we're speaking, it's I'm even laughing. The reason why I'm laughing is that I'm supposed to give whatever wisdom at Bloomberg.
Ooh, nice.
Yes, September 3rd.
Can I come, please?
I believe so, for the first year students. And
Wow.
it was that same institution. They asking if I have something good to say about, etc. And all that keeps coming to mind is a professor whom that very morning I got a call that my mom had passed, and uh, I had a pharmacology exam.
Right?
So I got there, I had the news, and I told her, "This is the news I got. I can't do it. This is the news I got." She said, "Oh, but you have pharmacology?" I said, "Yes." She said, "You can sit and do it." I said, "I can't.
Hmm.
I have studied. I
Mm-hmm.
was ready
It,
before I got the news." I said, "I can't." My saving grace was a one, I've forgotten her name. She was Caucasian background, South African, motherly figure, got to hear my news, said, "You can't do this. I understand. You have to go back home, go bury your mom. When you come back, we will set a new date and then you study." Lucy, if I tell you, when I came back to study to write that pharmacology, every time I went to sit down to study, I just burst out tears.
yes, because the trauma aligned
The
with.
trauma. It's like I still have to do this or drop out. It's like I cannot afford to drop out. I cannot afford to drop out. And my mind also is, how can this teacher who is a nurse,
Supposed to be a nurse.
supposed to
Supposed to
be
be
a nurse,
compassionate. Yeah.
supposed to be compassionate,
Yeah.
tell me that?
Yep.
So,
Mm-hmm.
as a matter of fact, I didn't like the damn school.
Yeah.
But that's the same place 20 years later I'm going to speak.
And you are going to inspire someone in a way where 20 years later, they're going to be in a different position because whatever you say is going to impact them in a fashion that you cannot anticipate. Right?
Oh my
But all
goodness.
that being said, first of
Okay.
all, I'm sorry you went through that. But it's those things that I'm talking about. So when
Yeah.
we talk trauma informed care,
Yeah.
education,
Education, yes.
that's all I'm talking about. That's all. It's like, there's a lot of fancy terms behind it. There is research that supports it on the most basic of levels,
Mhm.
humanity
Yeah.
in the teaching,
Humanity in the teaching.
right? You can tell if a person is not applying themselves
Hmm.
or what have you. Find out first why,
Hmm.
right? I had a student last year. I could tell he wants this and he's trying, but there's a lot of shortfalls all over there. At some point, we got a little closer and he felt comfortable sharing.
Mhm.
There is always a story. We are humans. There is always a
Mhm.
story. One, his father thinks him becoming an RPN isn't a real nursing job anyway, so you're wasting your time. So you have no support there. Two, his younger brother has a disability. And so he tends to look after his brother and is nervous about when the brother gets hospitalized and stuff. So that's on the brain. How can you
Mhm.
think? How can you
You can
study? Right?
stress.
Three, I get to find out he has his own health problems. And then you can start to see it on his face. I don't know what it was.
Mhm.
And, he would come to me and say, my clinical instructor told me I should just drop out because nursing is not for me. Or, I would hear certain people making fun of him that he doesn't have the wherewithal. But, like, that hurt me. And I'm
Mhm.
not that close to him like that because
Mhm.
where is your empathy? Right?
Mhm.
So I remember one time we had a midterm exam. He didn't show up. The rule is, and I probably shouldn't even admit this, but the rule is you don't show up, it's a zero, period.
Mhm.
That's it. You get a zero and then you're like on track to fail the course. So I wanted to find out what's going on with him. And he talked to me. I didn't have any room to retest him. It was one of those demonstrations where you have to show you can do a practical
Mhm.
skill. I say, you know what? I'm gonna sit here with you right now. No books, no nothing. It's just me and you. Tell me what you would do.
Mhm.
Say it
Walk me
straight.
through. Yeah.
Walk me through. He hit every point. Boom, 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 boom. Humanity, compassion, relax. Give the man room to think. Give space for him to feel safe.
Yeah. And
That is the
bloom.
thing. And then your mind can relax and open and be the wonderful person you are, right? But yeah, no, I find all too often it's a common thing and I don't know why. Maybe the teachers themselves are tired. I don't know.
So
Hmm.
I believe I believe that number one, were they meant to teach?
Great question.
Yes. Number two, is it for passion
Aha.
or just because I can and I got it, so I did?
You know what I call that now? I call it professional clout, right? It's
Yes.
like it makes your resume and your
Looks good.
portfolio looks wonderful. But
Yes.
who are you doing it for? The portfolio
So,
or for the students that you're actually trying to put out in the world to be great, fabulous nurses, right?
almost all the students I got is like, why are you not teaching in our class? I would take your class over and over again.
And they
It's like,
would. And they tell their friends. And the next thing you
oh,
know, your whole class is full. And you go, why is my so much students
even
is
this
capacity?
preceptorship,
Yeah.
when I was at Humber, I think midwifery student, one
Mm.
went, and the next one came and it's like, oh, I'm looking for Bernadette.
Specifically.
I, specifically, it's like,
Specifically.
I don't know you.
Yeah, too bad. I heard about you and I would like to
I
learn from you. Yes.
Yes, yes.
Yes.
And yes, we sat down and we went through, expectations in, when they go into midwifery, some of the challenges working within the team, and how are you going to be resilient in building and
Okay.
fostering team. The conversations that normally may not be had, we had them, and it's like those are things you think about and add to your skill level, and never be afraid to ask for help. We don't know it all.
Let me argue something. A
Mm-hmm.
lot of our educators will share these exact same things you said.
Mm-hmm.
The difference is, am I receiving it well? Like who's delivering the message essentially,
Mm-hmm.
right? Do
Mm-hmm.
do I respect that person? Do I feel like that person can even
Is it
understand
authentic?
is it authentic? Would they understand my struggles,
Mm-hmm.
right? Even being a black woman working triple time to try to prove that I know what I'm doing.
Mm-hmm.
You could tell me whatever you want to tell me, but do you really understand what it takes for me to try to be where you are,
Mhm.
right? And this is where I talk about psychological safety.
Mhm.
You are making your learners feel safe.
Mhm.
Anything you say thereafter, yep,
Mhm.
I receive it and I'm taking it.
Mhm.
I value it
Yeah.
because she
So
lives it.
that's true.
There you go. She lives it.
So
So I can copy it, right? Yeah.
my next question on this, trauma informed, how do we call it?
Teaching and learning,
Teaching and
education.
learning for
Hmm.
students.
Hmm.
What happens when these approaches are missing in the classroom or clinical settings? What do you see?
Great question. So,
Yeah.
wait, all you like number one, anxiety.
Mm,
Anxiety, fear, second guessing yourself, all the stuff you
mm-hmm,
said is supposed to happen, like come and ask for help.
mm-hmm,
Why would I feel like somebody is going to make me feel less than?
mm-hmm,
Or maybe I'll be judged. And all this
mm-hmm,
does is put more pressure. And
mm-hmm,
when you're operating with pressure and anxiety and fear and just a busy mind,
mm-hmm,
you're actually not synthesizing information. Scientifically, biologically, is there, it's proven.
mm-hmm,
If you're stressed, if you're reflecting on something that gives you that fight or flight response internally, there
mm-hmm,
is no possible way that you are retaining information um, in the way in which you should be. And this is a profession where people's lives are in our hands.
yes.
So even if you could do it, you probably had to work extra hard, like
Yes.
how you mentioned you had a tragedy,
Mm-hmm,
but you had to push through the tragedy
mm-hmm,
to just somehow get to the other side.
mm-hmm.
What if the initial person you came in contact with was the South African woman you were mentioning?
That stress would have been very, very minimal. I would have gotten all the necessary support without extra trauma because I was already
Exactly.
coming in with traumatic
Exactly.
news. And then she double traumatized me by putting the nail on the coffin that go do it.
It
I
is what it is.
can't.
Like, I don't feel sorry for you. Go get it done.
Yes, I can't. It's not possible.
It's not. And that's what happens. You can't, you like, and
I
you
would
said
have
you can't.
failed.
Exactly. So then what do? You end up repeating. You end up having to use more of your money. You have children, you have work, you have, you know what I'm saying?
And
This
I
is what
don't do
happens.
repetition. It's one shot, one shot.
I
So I
mean,
kill myself to study so that when I sit in the exam room, I know that I'm giving it my all.
mm-hmm, mm-hmm.
I may not
And
be an A student, but at least let me take my B away.
yeah, of course, 100%. It got to a point where I'm like, just get me out of here. Just move me out of this whole circle, like, and let me find another way to just thrive. Because
If you give me a C plus, just give me the C plus. So far as it's a pass, I'm gone.
bye. Because it still doesn't dictate the type of nurse you are.
It doesn't.
It
It
doesn't. And
doesn't.
a lot of, and that's another issue that I aim to tackle with some of these initiatives. We're still stuck in old traditional systems that are not applicable to our current society, our current way of living, the amount of mental strain that people deal with on a day to day, outside of the fact that they have the passion to become a nurse.
And the diversity in nursing also, the nurses and the patients,
Yep.
as time goes on, has drastically changed. The
Drastic.
mindset of patients coming in
Oh,
has
yeah.
the
The
Google
patients will make you
doctors.
nervous. The patients will make you nervous because they already came in with some knowledge that you don't.
They came in with Google Doctor Chat GPT, Doctor Chat GPT. And at the end of the day, I said, no problem. So is that the one going to take care of you or my years of experience that we are going to talk about? And I will lay it in front of you straight up. All these decision makings
Hmm.
either goes left or right. Either we run to the OR or you have a safe delivery.
Yep.
Do you want safety? What is the core of everything? It's about safety.
Exactly. And so if your student or your new nurse or whoever is learning and they're under stress and they can't retain and synthesize the proper order of what is supposed to be done to maintain the safety, what do you think is going to happen to patient safety?
Down the drain.
Right? What, and then even so, you ask what happens when, trauma informed education isn't something that people even think about. The great, like a really tremendous nurse that we could potentially have in our field can leave.
Oh
And
yeah.
that's exactly what's been happening, especially post COVID. I don't got time for this. Why I gotta stress myself out for this pay when I can make that same pay doing something else where they'll appreciate me more. And they'll just leave.
What just happened to me after 2 decades? I left.
And
And
that's sad to me because it's the experienced seasoned ones that they don't need to read a book to look at you and say, no, we need to do this, 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 and this. But the new ones who come in, they're not gonna know that off right off the bat. There's no way. So what does it do? It delays the successful health outcomes that could have been because of our experienced, seasoned, you know,
well, I
original
take my
nurses.
season out. I take my season self out.
I took mine out too, so there's that.
Yep, yep.
Yeah,
My dear, my dear, my dear. So let's talk about Nurse Decoded. Like,
yeah, wow,
it's like you designed it to address all these challenges.
exactly.
Break it down. So for our
Mhm,
brothers and sisters who, you come, you get into the healthcare system, many of us don't think about the challenges the nurses go through, or within the educational system. We have our children, our
mhm,
sisters, our
mhm,
nephews, our nieces going
mhm,
through it all. It's like, what are
mhm,
some of the challenges they go through, and how do we address them,
mhm,
most especially in this day and age? The
mhm.
world isn't like it was when I was there. There were what, 4 or 5 people, four people probably, who were
Oh,
colored in
right,
the
right.
whole class
Wow,
at
yeah,
U of T.
yeah, yeah, yeah. Mhm.
Yes. So it's like now you can see
A
quite a
little bit of
lot, a
representation,
little
yeah.
bit of
Mhm,
variety,
mhm,
coming through.
mhm,
But even at that, those with training are given, care to people at the end. How
mhm.
effective are we training them
Right.
to give great care? Not good care,
That
great
that
care.
there it is, that part.
How do we empower them?
Exactly.
How do we
Exactly.
bring that best part of humanity out of them so that nursing is not just a job,
Right.
it is a
Where I walk
calling?
around doing
Yes,
tasks, and then
it's a
no, like
passion.
you're connecting to another human being
Yes.
every time. Every time. You may not remember, like I don't know how many patients I've ever had, and of course I don't remember all of them.
Mm-hmm.
But what I do know is that I gave you what I would want someone to give my mother,
Mm-hmm. Mm-hmm.
right? I gave you what I would want someone to give me.
Mm-hmm.
I gave you that room to feel safe,
Mm-hmm.
to feel respected, and to feel hope.
Mm-hmm.
That I can go to sleep at night and say no one can ever tell me I didn't, take
Yeah.
that approach.
Yes.
That being said, though, Nurse Decoded basically is born from all of this discussion,
Mm-hmm.
personal struggles, and then, becoming an educator, wanting to
Mm-hmm.
help other people who are struggling,
Mm-hmm.
but then feeling like my hands are tied because I'm still working within the system anyways,
Mm-hmm.
right? And so I don't like certain approach, and maybe I want to bend some rules, but like it's just really, really difficult. It's
Mm-hmm.
really difficult, especially if you're working within an academic institution or you're working in a large teaching hospital, right? So I was educating in a teaching hospital for like 3, 4 years. And then I'm seeing the same thing at the bedside. These aren't students, these are people that have been working for
Mm-hmm.
5, 10, 15 years.
Mm-hmm.
And to your point, the landscape has changed dramatically.
Mm-hmm.
Patients are far more complex.
Mm-hmm.
Patients live longer. It is not unheard of to have somebody who's 103. It's not even shocking anymore. You just say, "Oh wow, like congrats, that's good for you, right?" And if they're living to 103, then there's all sorts of comorbidities in that mix.
Yes. Mm-hmm.
You need to be able to critically think, anticipate, and react,
Mm-hmm.
and also treat, right? And then not only are you just doing that, you don't just do, right? Here in this country,
Mm-hmm.
policies, protocols, guidelines, you mess around with your documentation, you mess around with the way in which you're thinking my license, right?
So unfortunately, it cages you so much that to take care of the human being becomes a chore. And
Right.
let,
Right?
let me
Because the
just
system is set up like that. That's not, you know what I mean?
and and I'll tell you that has been my biggest challenge because I'm a conversationalist. You
Yes.
get me by your
Yes.
bedside, touching
Yes.
you,
Yes.
rubbing your
Sitting,
feet, rubbing your
talking.
back,
Yeah. Yeah.
bringing you water,
Mm-hmm.
AJ on ice or OJ on ice, shaking,
Mm.
stirred, whichever way.
Top service.
Top service, girl. You don't know. I'll pamper you from here to heaven.
But then
And
guess
then it's
what?
like, oh, I
You don't
forgot
have
to
time.
document.
Yep. Did you sign your meds? Did you get the other
Ah,
patient down there? Did you respond to the doctor call? Did you respond to the pharmacist? Did you respond
so
to?
luckily enough, because I was in obstetrics, I don't have to deal with that.
Oh boy.
Much of that. Well, I kind of dealt with that in the big institution because it was very quick. But at least, even at that, I have 5, 10 minutes. I will do what I need to do, make you feel good, and run off. The
Yeah.
only thing is, you won't get more of me.
And that's the
But
unfortunate part, right?
yes, in the smaller institution I just left, I had the time and liberty to
Oh,
entertain you.
wonderful.
But it is the same place that I realized that my kindness was finished. I didn't
Yeah.
have anything in me more
Yeah.
to give, and
Yeah.
sometimes it just takes one patient to break you, and that was it. That was my workout. I
Oh
tell you,
yeah.
my dear, it's
Oh
like,
wow.
pardon my French, I'm done.
Yeah.
I don't have
Yeah.
it in me. I don't want to move. I don't want to work. I'm cranky. Left, right, I'm gone.
But you know what? Kudos to you because there are those who get to that point and they're still there for the paycheck. And you can
No.
feel it, you can see it, you can sense it in how they treat the subsequent co-workers, patients. It doesn't matter. You're just grumpy, you're jaded. You didn't start your career that way, but over time, whatever, and you're just not very nice, not very
What I
kind.
can say is
Yeah.
that my one of my very last moments was, having somebody that I had known for quite a bit, have established that relationship, and they delivered and I took care of them. So
Mm-hmm.
some of the last ending was fulfilling in the
Nice.
sense that yes, I had
Yes.
time
Good.
with this, new family, young
Yes.
family, and
Yes.
it was like, this is why I do this, but I
Right.
don't have it in me anymore. Right.
Let's say
So
you have it, but in a different way. And this is where Nurse Decoded comes in. Because it's like, how can you ensure that the patients of tomorrow are treated in the way that you were able to function and treat them with the compassion, meet them with the empathy, meet them with uh, the respect, the conversation, the
mhm,
therapeutic relationship that our college tells us to have with all of our patients, right? So, how do
some
you
of them
get
ain't that therapeutic. Some of them
right?
are traumatic for me.
Sometimes it is, and sometimes it is, but like, how do you train the next generation to be just that when they're under
Mhm,
so much stress, so much pressure?
mhm,
Everything is stress and pressure. Learn this, learn it now. I started to teach, and then I was, disheartened that I didn't have time to really make the student feel comfortable and grow in the skill and feel like they mastered it. I had to move to the next because the
mhm,
course outline says we're going to learn how to give meds by mouth next week, subcutaneous next week, intramuscular next
mhm.
week, wound next week, catheter next week, IV. How? And they're taking 5 or 6 courses at the same time.
It's a
Kids,
dump.
kids, they have children, they have jobs, they have health issues, they have people to take care of. And majority are actually international students now, which is even so all of that. Are we still going to use the same traditional systems that is in place? You missed the exam, it's a zero, whatever. No second chance. Why? Why?
Then you lose great human beings who
That's what
can
I'm
be exceptional
exactly.
um,
Exactly. So Nurse Decoded
nurses.
essentially is the space where you can come.
Mhm.
It's honestly, it's first of its kind, and I need to be more comfortable saying that confidently.
So let's really get into that. So how
Yeah.
does it differ from the academic classrooms or hospital-based setting?
On the easiest way I could say it,
Mhm.
you are in charge of your learning with access to the same things that your institution, either academic or clinical, would
Mhm.
have, the equipment, the same medical equipment that you would need to
Mhm.
use in your practice. It's here for you at Nurse Decoded. Whatever it is that is giving you some strain, some stress, you want to be proficient at it, but you don't have time. I was an educator at the bedside, and they wouldn't give me protected time to teach people. It was really hard. And and maybe I have some older nurses, they need a little bit more time. And I'm ready to give them the time. The boss says, no, no, no. They need to work on the floor. If you're going to teach them, you better find them 15, 20 minutes on the floor and try to get them to learn. But remember what we just said, if you're stressed and under pressure,
It's not
and
going anywhere.
how? So I'm like, well, this doesn't make sense, you know? And everything came down to money. I said, if you give me 3 hours, let me pull the nurses. I can teach them. They can practice. They can be
Mhm.
confident. Then they can go back and we won't have incidents.
Mhm.
No, we don't have budget to backfill. Nope, it's not happening. Nope, figure it out. Okay. Nurse Decoded is
The
me figuring it
solution.
out. You come for 1 hour. What do you need? Do you need me to show you how to do the skill from front to end? Or
Mhm.
maybe you know how to do it, you just need a little refresher. Or
Mhm.
you just, you decided, I don't want to work in this particular setting anymore. I want to try a new setting, but I'm
Mhm.
afraid to go there because I actually don't have the skills of that specialty.
Mhm.
No problem. Come over here. We got the instructors that will teach you the skills in advance of your interview, and then you could walk in there with less anxiety, more.
Mhm.
And part of this, the goal is to help retain, right? It's not the all end all be all solution, but it's a major player
Mhm.
in what gives us a lot of anxiety um, and reluctance when we go to
Mhm.
work. Because
Yeah.
not only are we doing the skill, right, and trying to get the person to feel better, we're also being watched.
Yeah.
Somebody is always watching what you did and how you did it. Always.
And I'll tell you this, it doesn't matter how long you've worked in the profession
Yeah,
that
they're watching.
eh, you can bat an eye or deliver in your sleep and do things, and people are your clients are very confident in you.
Yes, yes,
Somebody will always have
yes.
something to
Yeah,
say about
yeah. The one thing that wasn't perfectly followed the protocol and policy, best believe they're gonna call you into the office. But what
yes.
about the 300 patients prior to that where they were all happy, I was happy, everyone was safe and healthy, and they walked out of here in great spirits,
And
right?
I've
And
had to deal with that.
that is why people leave the profession, if I'm
Yeah.
going to be honest. It's feeling underappreciated.
I asked, what is it about me that makes her that that makes me her target?
Yeah, it's weird. It's weird. It's
What
happened to me
is it
before.
about
Yeah,
me
yeah, yeah.
that makes me her target?
Yeah, I don't know.
And I don't want to start with her. And she's a
Hmm.
junior nurse.
Hmm.
I don't want to start with her. But if I do start, it's going to be fireworks. So I need HR to have a conversation with her.
Yeah.
I am the wrong woman to mess with.
And that's the other thing.
If my
It's not,
patients
yeah,
complain, it's a different story.
yeah.
But for you,
A colleague who's
you
supposed to be
decrease.
upskilling, like working together. Let's work together. We're all tired in the same profession. Let's
No,
help each other.
because you are ADHD or meticulous or whatnot, you want to put everything in the computer, write T's and cross them. Well, I want to massage my patient's foot. I want to do back massages. I want to give them hand massages.
God bless you. No, and this is
I
what I'm
want to make
saying.
them laugh.
Yes, that's
I
healing.
don't want to cross some T's and dot some I's.
And that's where people
And
like
if
you
I
get
forget,
frustrated over time. Yep.
oh, yes,
Yeah. Because your real compassion and passion is people, not
I did not
policy.
study computers. I studied
Right.
human beings.
Right. Exactly. Exactly. So
The
when
baby
you
doesn't come with a laptop or
no.
whatever in hand. The baby comes and it's like, "Are you breathing? Wow, this is my breast milk. Let me give me my food. I pee, I poo. I'm taken care of. Mom, are you bleeding? No. Daddy, are you okay? Yes." It's like,
There's a whole lot of in between that you miss that your boss needs you to account for.
well, I told one how do you call it, one person that, listen, babies don't care who delivers them. You
Yeah.
can deliver them in the bush.
Mm-hmm. They're not gonna
Sometimes they're not gonna know.
know.
You can deliver them in the back of the house,
Yeah.
by the roadside, in the bathtub. You call 911, paramedics bring them. Babies don't care. But when you come here, what I care about is safety.
Mm-hmm.
Because number one, you came with a baby kicking in your belly. It is my responsibility.
Out with the same
Out
energy.
with the same.
Mm-hmm.
If I leave and I go home and anything happens, that is my back problem. But so far as I'm here, we
Mm-hmm.
are going to do everything as safe as possible.
And
I
part of that is mastering the skills.
Yes.
Be confident in yourself. Even if someone is watching, pressuring, you won't be shifted because you know what you know. You had the
Oh,
room to do it and to grow and to master it without anybody interfering. So the space we created is essentially
mm-hmm.
like a hospital with or like a care center is what I'll
A
say.
care center. Okay.
It's like a care center. We got the hospital bed, we got the head wall, we
Mm-hmm.
have IV equipment if someone was on a G feed for enteral feeds, if someone
Mm-hmm.
had a tracheostomy, if somebody had a colostomy, any kind of surgery, severe wounds, if they needed catheterization, we have all of it there. Come peacefully, have some tea, have some coffee. It's a
Practice.
nice, calm environment. Practice in peace. Your educator is not standing here.
Mm-hmm.
Your manager is not standing here. The person you work with who likes to report you for fun is not standing here. And I'm telling you all this because even as an
No.
educator, I would get those emails.
Yeah.
I'd get the email from your colleague that said, as I was working, this person, I saw how she was doing this with the patient, and it didn't follow what it was supposed to follow. Now, mind you, the patient's not at risk. Patient's safe generally. But what were you doing that you have so much time to be watching what they were doing?
As my people would say, kokonsa gossip.
And all the time I'm be asking myself, okay, after all that, what was happening
Mm-hmm.
with you and your patients?
Mm-hmm.
Right? Yeah, I'll address this person. What about you? Are you perfect in all the skills you do? Why don't you go to them and help them? Why don't you ask them, do you need a little more guidance? Normally, this is the way it's supposed to be done. And this is the reason why it's supposed to be done that way. That's it. But for whatever reason, I don't know. That just it's missing on all sides. Education, clinical, acute care, rehab care, long-term care. And I'm saying this with confidence, mental health care, because I've worked in every single one of those fields
Mm-hmm.
and it's consistent. Even if you want to come and work on your mental health skills, mental status examination, come on. You want to learn how to converse with a person to de-escalate a crisis.
Mhm.
Come on over. Because you can do that peacefully. You're afraid to call the doctor because you don't want to get blasted for not knowing how to articulate yourself quickly, correctly. We got that too. Come and practice it with us. We have the case scenarios. Just come in peace and go in peace. That's all we want for people.
If you like me, you put people on strike one, strike two. The third strike, you will be talking in there.
Yeah, listen, no judgment. That's what we say, right? And even on the
This is
website, we have it
funny.
like that. It's judgment
Hmm.
free.
Yeah.
Just come as you are. Let's work on whatever it is you're lacking and
Hmm.
go to work with the more confidence, knowing that you'll be able
Confidence.
to
Yeah.
take care of the patient
Hmm.
safely and compassionately. And then also at the same time,
Hmm.
it's a better healthcare system for
Yeah.
all. Yeah.
Great. So let's look at the bigger picture of, nursing retention. We've kind of
Oh, yes.
workforce and health outcomes because uh, uh, I know there's one aspect that we often don't talk about when it comes to nurses. It's PTSD
Oh my God, yes.
and the anxiety and everything. People think
Yes.
we should have all the answers and be strong and be able to take their barrage of
Abuse.
abuse and everything. Let's talk about that.
Retention. Yeah, yeah,
Yeah.
yeah. So part of that retention, like bottom line, all these things we discuss, if our organizations, institutions, um, approached things in that way, you would retain so many more individuals.
Mm,
But as we all know, everything is a numbers game. Or maybe we don't all know. I learned it the hard way, and it actually hurt me when I learned it as a young baby nurse.
mm-hmm,
And I'm fighting for certain things for my patients. And I said, well, this doesn't make sense. And then why would they make that decision? It's going to compromise everything.
mm-hmm.
Doesn't matter. Money first. I learned the hospital is a business too.
Yeah,
This-
it
And then the
is.
school is also a business too.
Yes.
First, right?
But how do
But
we humanize this business?
exactly. But would it not make sense to humanize it from top down so that the entire culture would humanize it? I mean, there are a few of us who are trying our best, but you can only do it in
I,
silos, maybe, right?
Yeah, and I think you know what, it depends on the organizational head.
That's true.
I
Yep.
remember having a conversation with when we got a new CEO. I
Mhm.
asked him about his leadership style.
Ooh, wow.
Oh yeah, it felt like an interview like this. My director said, "Oh, actually, she does interviews. She used to be a manager somewhere else." It's like,
Yeah.
"Why are you here? Why are you not in management again?" It's like,
Mhm.
because I miss my mamas and babies.
That's what I was
I,
gonna say. Yeah.
I don't miss them anymore. But you can't pull me to the bedside any longer. I'm
You've done
sorry.
your time.
I've done my time. But I got to understand the man's, values as a leader.
Hmm.
And what he's doing was also to coach and mentor other leaders within the institution. And my immediate manager slash director was a servant leader.
Okay. Okay.
So you see, they know themselves.
Yeah.
And you could tell how it flowed onto the unit,
Of course, top down
top down.
for sure.
So a
100%.
person like me, when I'm in there with everything I see, I hear, I absorb, and be able to articulate myself.
Hmm.
If you don't know yourself as a leader,
You got to find
you
out.
cannot lead me.
Yeah, because you're
I'll
not a
tell you,
follower.
I'm not a follower. I'll tell you, Humber,
Hmm.
the reason I left. There was a director then. She wanted to institute a policy. It didn't make one bit of sense. I opened my mouth and I
Yeah.
said, this may not fly here, but in order to make it work, Yes, Sunnybrook and Women's is doing it. That's perfectly fine.
Yeah, but you
But
have to
for
understand the context. Where are you?
yes, but in order to make it work here, we may need to look at what goes on here and readjust.
Mm-hmm.
She told me categorically that it has to work. I said, okay, no problem. I looked her up, down, walked away. I'm in triage. It starts in triage. It starts with
Yes.
me.
Yes.
I'm at the bottom. I'm seeing
Yeah.
something you don't see,
Yeah.
and you
You
don't want to listen to
too.
me.
Right. Because on paper, it looks nice to whoever on the other side of her that is going to read it and look at it and respect it. But does it make sense practically? Pragmatically?
I said,
This is why
I'm
nurses
here.
are always annoyed because this kind of thing happens all the time on top of all the stuff you're dealing with.
I said, no problem. No problem means I need to prioritize what is important to me. It
Yeah.
is not a piece of gadget, it is the
No,
human being.
exactly.
And so I
It
just
is.
threw the gadget somewhere and just focus on the human being.
Yeah, I've had those situations too. Yeah.
If you come in, you are hot and heavy in labor, I'm not picking that up. I'm taking care of you. I'm taking care of the baby.
Mm-hmm.
I'm taking care of daddy until
Mm-hmm.
all of you are safe.
Maybe I'll
And
touch
if I'm not done with my documentation, it is at the bottom of everything else.
because it's not priority. Just so I can say to the manager, I did what you wanted me to do for whatever tracking
No,
you want to
I
track.
don't kiss ass. I'm sorry.
And
It
see,
wouldn't work.
and I'm gonna be honest with you, that the people who don't do that are the people who get shifted because they need people pleasers, right? They need the ones to say yes.
Listen, I'll fire myself. You don't need to fire me. I fire myself.
But
I'm
this is
done.
and it's unfortunate because you would be the best type of leader, right? You would consider your people's perspectives, work collaboratively, and let's all make this great together. Anyway, I don't know why that is always such a struggle, but it is, and it's common. And
Because many human beings are power hungry, and when they get into certain positions that they probably never dreamt of themselves, or as you say, it is a whatever it is,
I think it's overcompensation.
overcompensation that
Yeah, yeah.
and when they see that you are very well spoken.
Oh, that part. You better. So I learned that too, even in the educator role, because if you're a person like you or me, and you will always stay grounded to what it really is,
Yes.
even if you're sitting in the big virtual meeting with all the other executives, when something doesn't make sense, you put your hand up. Just so you're aware, this is how it's going to impact, and it ruined their whole plans, and now they don't like you. So you gotta, I don't know, be
So,
strategic, or in my case, create something that nobody can tell me how to run it.
mhm,
Right.
mhm,
The
mhm,
other factor that also really made me want to do this was the internationally educated nurses.
mhm,
They were always here
mhm,
and they were always put on the back burner.
mhm.
And we all knew, wow, we have so many skilled human beings that you make them jump through hoops upon hoops to get their license in Ontario if they get it.
Mhm.
Fine. You can have someone in the country that's been here for 6 years, 7 years, was a stellar ICU RN, wherever country they came from. And in that country, they didn't have all the same supports we have here and they made it work. But
Oh,
when they come
yeah,
here,
I can tell
yeah,
you.
yeah. And then
Mhm.
when they come here, they say, well, your education is not on par. Start all the way from the bottom again. Okay, fine. COVID-19 happens. All of a sudden, mass exodus of nurses for very, very various reasons. And all of a sudden, you know what? Let's we know we have a lot of internationally educated nurses that are unlicensed because of our bureaucracy. Let's all of a sudden bring them in.
Afterthought.
Yeah. And while we're bringing them in though, let's fast track how fast we bring them in. Swung the pendulum all the way to the other side. And not because they're incapable. This is not what I'm saying. What I'm saying is, you didn't even give them time to think, breathe, synthesize, not how to nurse, but how to nurse in this Canadian healthcare
The
system with
healthcare system.
all the
Yeah.
stresses that we just discussed.
Yes.
It's
Yes.
different.
Yes.
How do you communicate to the patient? How do you
Yes.
communicate to your team members? What does collaborative practice look like? What
Yes.
does critical thinking initiative? What are you allowed to do? What are you not allowed to do? Scope,
Mm-hmm. Mm-hmm.
right?
Mm-hmm.
All of that takes a bit of time if you want someone to learn it properly.
Mm-hmm.
So why I said all this is, there's a new program that came out, and that's good. I'm glad for it because it brings people that are skilled and hiding out there. It brings them into the field and they can share their expertise. But then you need to support them accordingly,
Mm-hmm.
safely, pressure free, and
Mm-hmm.
understand there are multitude of factors around them.
Mm-hmm.
So, first example I will share, and I shared this example a number of times now. 2 years ago, 3 years ago, right before I went on my maternity leave, we had a very nice woman who was placed on our unit, and they gave her 4 weeks. They said minimum she has to do 4 weeks placement. If she does well, then you hire her full time. I said, but the maximum you can do
That's
is
6 weeks.
yeah,
Or you
300, 300 hours actually.
300
Right?
hours.
So they said minimum she has to do 175. That's really like 2.5 weeks. I mean, sorry, 2 weeks and a bit. I mean, 1 month and a bit. So two
Mm-hmm.
paychecks is what I'm thinking of, right? 2 cycles and a little bit. And I'm like, that's not enough time for her. When we go to nursing school, we do like 900 hours here, right? You and I, like the average
Mm-hmm.
nursing
Mm-hmm.
student in Ontario does like maybe about 900 hours. So why would you expect her to get everything she needs to get in 175 hours? So anyway, I ignored that and I extended it to the 300 right out the gate, right?
Mm-hmm.
She had the personality of a human that is what we were describing:
Mm-hmm.
compassionate, humble,
Mm-hmm.
hungry,
Mm-hmm.
kind.
Mm-hmm.
But her skills were lacking. She's been in the country for 7 years. They weren't
Mm-hmm.
letting her get the license prior, so she switched and did ECE. You have to
Mm-hmm.
make money somehow. And she was
Yeah.
doing that. Now this whole new thing changed. She saw the opportunity. So now she's in and she gets assigned a preceptor. So she's with you. She follows you. But I, as an educator, I also follow too to make sure that,
The
are we
preceptor is also very important. It's a
very.
make or break. As
So let me tell
a
you what happened. Let me tell you what happened. So the preceptor, I mean, I thought she's a good nurse, but it doesn't mean she was a good teacher
teacher, yeah,
or a good person to
or
guide. I don't know.
fit.
Yeah, maybe. Yeah, the fit. Let's say that.
Mm-hmm.
And so whatever, it wasn't translating well. And I
Mm-hmm.
can hear the other nurses on the unit gossiping about this person and
Mm-hmm.
complaining. Her assessment skills are poor. She doesn't know how to do this. She doesn't know how to do that. Nah, we can't hire this one. Blah, 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 blah. So I said, okay, hold on a second. Let me get in my scrubs and let me follow her and see what's going on with
Mm-hmm.
my own eyes because I don't really trust you guys.
Mm-hmm.
I follow her. It's true. There's some weaknesses and some missing
Mm-hmm.
elements. But remember the personality that I described to you.
Mm-hmm.
I spoke to her. I said, listen, so I watched you. This part is where you can improve. When you do this, this is why you do this, giving the educate. And
Mm-hmm.
she was receptive. She
Mm-hmm.
received the criticism.
It's the
Thank
approach.
you. Thank you for sharing it with me. I'm going to work on it. I say, you can probably benefit from like a health assessment course, maybe like an
Mm-hmm.
intensive couple
Mm-hmm.
weeks or whatever to refresh your
Yeah.
skills. The next day, I sent her a link just as an idea. The next
Mm-hmm.
day, she's paid maybe like $1,700 straight, just like that. She said, I registered for the course. I want to get better. I need to be a nurse here. I've been waiting for so long. I sent
Mm-hmm.
my daughter back home.
Mm-hmm.
She had like a 3 or 4 year old. I sent her back home so I can focus and get my license, and then I'm going to bring her back. I said,
So that's a huge sacrifice and dedication.
so why wouldn't you support someone?
So she
So we're
needs
talking.
to win for her, not only for herself,
Yeah.
but for her daughter, for the
Yes.
family.
Yes. So, now it's time. Her placement is finished. She's okay. People saying, don't hire her, blah, blah, blah. I said to myself, nah, because you could teach anybody skill. If you guys are complaining about skill, she's going to get the skill. You can't teach attitude, you can't teach character.
You
That I don't
can't
have
teach
time
all
for.
no.
So we hired her. I went on maternity leave. I left. I came back 14 months later. Bernadette, this woman was not only the team lead, she was leading morning huddle, she was charged, and she was in the middle of completing her NSWAC to become a CNS.
And
14 months later,
where are all those that were complaining? They're still sitting where
same
they're
position,
sitting.
the exact same position.
Yes.
Yeah, of course. She,
Yes.
I saw her, she makes my heart smile, like, and she's
I
so thoughtful and appreciative. And basically, I want to create a space for
mhm,
those individuals who may not be given a fair chance,
mhm,
come and work on the stuff that they want to write
mhm,
you off for,
mhm.
essentially. Yeah.
So quickly, just to sum it up, or
Mm-hmm.
give us a view, if you
Mm-hmm.
could redesign nursing education in Canada from
Oof.
scratch, what would it look like?
Wow, that's $1 million question. From scratch, eh?
Yep.
Well, the theoretical components, I'll still leave it because we need to know these things
Mhm,
foundationally.
mhm,
But I would want to change the model that is learn fast and under pressure.
mhm.
I don't know why we are under, like, I don't know why we're wired to think you have to pressure people into acquiring knowledge. That's not, you know what I mean? Like, it's something about that doesn't sit well with me because not everybody learns that way. Most people don't learn that way. If anything, most people will learn when we can do what we're doing here: converse, relate,
Yeah.
share experience, and grow together. That's how
Or,
I would modify it. And
or
I'd make sure
is
that the
it that we
teachers
haven't looked at the different learning styles,
see, so we say it, we say we look at it, we know they exist,
but we don't apply it?
but we don't apply it, not because we don't want to sometimes too. You see how you say you didn't have so much time to spend with your patient, but you want to spend with your patient.
Mhm,
I want to spend time with the student, but I don't got the time and the space in the current
mhm,
system to be able to do it
mhm,
unless I come outside of my time and do it.
mhm,
Right?
mhm.
So, you know what I would say to answer your question? Humanity training for educators before you even walk in here. And it's not just our field, every field, this a accomplished person and then they give them a role to go teach at the university and you're like, just
Okay.
just because
Be-
you're a good architect doesn't mean you can teach me about architecture in a fashion
that
that I understand, right?
that is the reason why because I saw so much lack of human values.
That is
That
what
is
it is.
the reason why I started doing those webinars on
Exactly.
human values, because it's
Exactly.
very, very
Lost.
important.
Yeah.
It is lost.
And it's not
With
prioritized for some reason.
It's not prioritized, and they say, oh, you're so good with people. Yes, because I know who I am
Yeah, and you just treat people
and I
like
have
how I
my
want to be treated.
values.
That's it. Like, it's not complicated, but I don't know why, there's always these barriers in the way. Um, and so yeah, that's what I would do. I even actually, when I was completing my master's,
Mhm,
this is where I got all this trauma informed education
mhm,
because there was one professor who showed me that compassion.
mhm,
I had a 2-month-old baby
mhm,
and I was already struggling through this thing. It was taking too long to finish this master's thing, and I had
mhm,
invested way too much money. The debt
mhm.
is waiting for me. The baby's here now. Do I let it go or do I finish it? What do I do? She's stuck right on the
Yes,
boob. So what do you
yes.
do? And I told the woman, I am trying my hardest. My brain. I'm not sleeping.
But within nursing too, I there should be empathy, because you are in the perinatal period.
Exactly.
Anxiety, depression. Now this is
Exactly.
obstetric nursing
Exactly. No, no, but
talking.
it's
So
true. So how
from
am I able to synthesize information and give you whole essays?
the hormonal balance is already balancing. Baby is at the titty pulling
Yeah.
you.
Yeah.
Everything is just
Yeah.
not.
And so I
Yeah.
said, I need to have a meeting. So we did a video call like this.
Mhm.
And tears just start coming down my face. I'm like, look, I am trying so hard and I need this, not because I want a piece of paper, because I know what difference I can make once I get it.
Mm-hmm.
She said, you know what? Let's do this. We're gonna make a plan. We'll check in with each other every couple of weeks. Don't worry about the deadlines.
Mm-hmm.
We'll get you will get the assignments in.
Mm-hmm.
I want to make sure you're okay.
Yeah.
That's what she said.
Mm-hmm.
I can't put into words how much that meant to me and that
Mm-hmm.
can mean to a person.
It means
When
so
I
much.
deal with my students, they will all get that same energy.
Yeah.
Always.
Mm-hmm.
Always.
Mm-hmm.
And they tell me back, Miss, thank you.
Yeah.
Because I know I wouldn't have passed this class. I said, well,
Yeah.
I know you're capable, but whatever
Mm-hmm.
nonsense you were up to, don't be up
Mm-hmm.
to that nonsense again because you're not
Yes.
going to get me,
Yes.
And then she taught me about trauma informed teaching. She said, oh, there's a thing like that, whatever. Maybe you do your project on that. When I started reading into it, I said, oh, that's what she just did for me.
Yes. Yes.
Oh, what about
Yes.
those of us who work at the bedside? Who's giving us trauma informed teaching?
Well,
Nobody. So I
for
started writing about it.
so trauma informed teaching, many institutions are now teaching about trauma informed care.
That's different though. Well, it's
That's
the
different.
same.
It's
It's
the
this
same, but it's towards the patient. But what
exactly.
about
And that is
me,
exactly what I was writing about. And one of my goals,
the traumatized nurse?
exactly. That is exactly what I wrote about. And my goal is for it to get published. I haven't been able to get it published yet, but my
Mm-hmm.
sincere goal is to get that manuscript that I used to graduate published. And it
Mm-hmm.
was that. We are taught to function with trauma informed care. Period, point blank. You're not allowed to treat the
Mm-hmm.
patient any other way. Well, what about all the trauma we face? And then you just come to me with expectation, no compassion. You need to know it, and that's it. We're not nothing in between. I'm a human too, right? Like, how come nobody wants to give me some trauma informed loving, right? So I wrote about just that. And it was like
You know,
2022 ish. I said,
yeah.
look at what nurses just went through.
Mm-hmm.
On top of the fact that pre COVID, there was this very shocking statistic. It is like 60 to 70% have reported some sort of mental burnout,
Oh yeah.
depression,
Oh
anxiety
yeah.
pre COVID.
So just imagine COVID hit.
And we're still operating in the same system? How?
Just imagine COVID hit. Yeah.
This is why we don't
So
retain anybody. Everybody leave. Either they're gonna leave to go make more money someplace else and then just call it, or they'll just leave the profession entirely.
it just leave the profession entirely. So unfortunately.
It's
Well,
unfortunate. Hmm.
where do we find Nurse Decoded for people
Woo!
who want to find where Nurse Decoded
We are
is?
downtown Toronto, Richmond and Spadina,
Mm-hmm.
specifically 477 Richmond Street West. We have a
Mm-hmm.
beautiful training center. I thank God.
Mm-hmm.
I give God all the praise because I don't know how I landed such a thing.
Mm-hmm.
Floor to ceiling windows,
Mm-hmm.
place to relax, all the equipment you can get your hands on,
Mm-hmm.
and just love in
Mm-hmm.
that space. Right.
That's
So
beautiful.
that's where we're at. We have our launch happening next week, Thursday, September 4th.
Mm-hmm.
It it's surreal. It's surreal. And I see nothing but goodness because that's what it's about. That's
Yes.
what it's rooted in. That's the foundation. That's the vision. And I will not allow it to deviate from that.
That
Right.
is so wonderful. Girl,
Yeah.
you've made me so proud.
For all
It's
of those at home who haven't been able to tap in, Bernadette was one of my teachers. But she wasn't even assigned to be my educator. She was adjacent. She was the other nurse working over in the other corner, while my nurse was supposed to be, showing me some stuff. It wasn't really working out, but I was watching and learning from Miss Bernadette.
and I will tell you this. Then I didn't do it directly. I did it indirectly
Oh yeah,
because of some
yes,
politics
yes,
there.
yes, yes. Oh no, no,
So
I caught
I
it.
yes,
Oh, I had caught
but
on. I knew what
If
was
you
going on.
needed me, I'm always in your corner. If you
Yeah.
needed me,
Yeah.
that was
Listen,
never a problem.
I made it
Yes.
my duty to. Can I come and follow you when you're gonna go deliver this lady's baby? I'm just gonna stand beside you, and then I would watch and I would
Yes,
observe.
you're
And all that.
most
You know,
welcome.
the things you were doing is things that I was advocating for myself when I was pregnant. How many years later is that? That's a lot of years later.
Don't give
Yeah,
up
yeah,
our
yeah.
ages.
Yeah, maybe like a decade plus later. I'm still thinking there was a nurse I worked with. And I was telling my husband, I said, and she would do this and this and this. I want that. And I'm not compromising. I want that care when I get in the hospital. And it's just so weird. Like a year later, a year ago, like not even a year, less than a year ago, I think you
Yes.
reached out to connect, and I said, "Wait a minute!
Yes, it's Bernadette.
Oh my God, I found her!" Yeah, man.
I've always been around, Lucy. I have
Yeah,
always been around. And
yeah.
it's so beautiful to see you bloom and continue to bloom.
God bless you. Thank you.
It's so thank you so much for sharing your insights in
Thank you.
Nurse
Thank you.
Decoded.
Thank you. Thank you for
And
the conversation, for hearing me, for
yes.
getting me. You know, sometimes I think I'm just like on a soapbox venting, and I'm like, is anybody understanding what I'm trying to say right
No,
now?
no, no. I got you. I
Yeah,
got you.
yeah,
I
yeah.
got you. I got you.
Hmm.
Listeners, if you had a wonderful time and you want to learn more about Lucy's work, please check out Nurse Decoded. We'll put the information in the bottom and follow her journey in creating a safer, more supportive nursing educational spaces. Whether you like nursing or not, if you get sick, you get to
Yeah.
the hospital,
Oh, yeah.
you will meet a nurse.
Someone's
So
coming
you
to be
better
there.
support us so that we
Hmm.
create the best nurses to come out of institutions, nurses that are supported with their skills. Because I always say, when you get to a hospital, if you get a great nurse who knows what they are doing, say hallelujah. Because we catch what the physicians don't see.
And it's actually our job to do that. People don't know.
Yes,
It is in our license, sir. Like it's an expectation that we catch it before it reaches the patient, believe it or
yes.
not. So,
So when we're training, we train great. And if you meet somebody like me whose safety is safety, 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 everything is all safety, safety, pin, 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 safety, safety. If it ain't safe, I might have a fight with the doctor right.
oh yeah, oh yeah.
Okay, I'll not. Oh well, I'm not by the bedside anymore, so I can say it. I might have differences in opinion right there,
I have
and
certain
I'll
neighbors.
apologize later, and
Oh,
I'll tell you the reason why I did that.
I'm not apologizing. I'm not apologizing because I'm trying to save somebody's
No,
life. What
I
are you doing?
apologize to the client.
Oh yes, of course, yes, of course.
And you know what? At a certain point, they realize that, you know what, when Bernadette says this is probably, yes, she's on my side.
No, they
Because
know
I've,
that,
I've
and they know.
established that, relationship with
They
them
know.
for a
They know.
long time. And I take time to listen and answer the questions
That's it.
as best as possible.
It's really
And
not
give you
hard.
time to synthesize and don't
Ex-
push you to make any decision. So yeah, there's
exactly.
always a method to my madness.
Exactly. You know,
Yeah.
Bernadette, please come and be one of the instructors at Nurse Decoded so you can impart this wisdom, please. Because that is what this is trying to embody. So, I'll be reaching out for your obstetrical knowledge
And you'll be most welcome.
because I
I
don't got it. I don't got it. I want the seasoned vets who have those particular skills to be the ones to provide that education. It won't be me.
I will be of service at the cervix.
Nice. Our healthcare people will get it and they will laugh.
And they will love. Thank you so much, Lucy. It's been a
Thank you.
wonderful
Thank
pleasure.
you. God bless you. God bless you. God bless you. Thank you.
Likewise. Guys, please remember to like, share, and subscribe. And if you have any questions in regards to nursing education, support, connect with Lucy. She will be able to assist you with that. Me,
Yeah.
it's questionable.
She's
Thank
lying.
you.
She's lying. She'll help you.